Microbiology is the branch of science which deals with the study of microscopic organisms. So we know the microscopic organisms, some are pathogenic and some are non-pathogenic. So microbiology deals with the whole microbiome family and their biological process, their host, interaction, and the whole biological life cycle of all types of microbes. That is mainly deal in the field of microbiology, and virology is the branch which deal with the biological process of all viruses. We know it also come under the great wing of microbiology, but slightly different because it's only deal with the viruses. So that is the basic difference, and also the similarities between the microbiology and virology. So, what inspired me to step into this field is a little difficult to answer, but I must say during my UG discipline, I have I have gone through so many seminars, so many talks, and I have gone through various tremendous inventions about in the field of microbiology, medicines, chemistry as well, like vaccines and recombinant DNA technologies, sophisticated equipments, all this. And my teachers, mentors who have inspired me, who have encouraged me, uh, these are the factors based on which I am today in this field. So this field is very interesting. I feel very interested here, and that is the simple answer, I think. So for choosing a career in the field of microbiology or virology, because see, this is a broader pathway, we must say, and these pathways are all interlinked and interrelated. You can consider microbiology, either microbiology or virology, or immunology, biotechnology, bioinformatics. These are the branches of biological science with updation in the latest technology, updation in latest inventions, and so many sophisticated techniques for the betterment of over the traditional techniques. So, to choose this path, one student must have biology and chemistry as their subject at their 10+2 level, and then he or she have to do the undergraduate course BSc in either life sciences subject like zoology, botany, or biotechnology, or even in MBBS. After MBBS also a few students came to this field, and B Pharma is the branch, and agriculture, veterinary science. These are all the broader branches of undergraduate sector. After that, after completing the bachelor degree or undergraduate course, they can go for the masters to take the specialization in the field in microbiology, whether MSc in microbiology or MSc in virology, or maybe MSc in biotechnology or bioinformatics in the advanced biological sciences. So there are so many institutions who are providing the master's discipline in their curriculum. So for virology, the topmost institute is the National Institute of Virology, which is in Pune. So to get enrolled in this course, students should study hard, and they will have to appear on online entrance aptitude test for getting seat in the master's program. And other universities are in the northeast. If I am not wrong, the MSc virology course is not available indirectly, but after doing MSc microbiology, you can also come into the virology sector, because it is the similar discipline. And nowadays when the job opening appears, it is clearly written that either MSc in biological sciences or biotechnology or microbiology or any other similar courses. So basically the experience, post educational experience is most important. And for microbiology, taking microbiology as a career, one can do masters in microbiology at Gauhati University also. But Gauhati University masters program in microbiology is I think under the Department of Botany, and it is also at NEHO. And for notice, some other private universities are offering the master's course in microbiology, such as Royal Global University and some downtown university, I think. And I'm not aware of the USTM and all this. But if you go for the better option, I suggest you must appear in the national eligibility test for means national entrance test for the topmost institution. Like for NIV Pune is the topmost institution for virology, and JNU, New Delhi, like that. Jamia Millia Islamia University. These are the topmost university, I think. And St. Anthony's also offering the masters in biotechnology also. And biotechnology course is available in every universities nowadays, including Gauhati University, Dibrugarh University, and in Tezpur University there is a department called Department of Molecular Biology and Biotechnology, MBPT. So these are the, I think, the top university, and one can pursue any master's degree in this discipline and start their career. So far skill is concerned in this field, this is the general. If I will answer in general, the discipline, hard work, these are the general criteria for to be a successful student or successful worker in any kind of work, any kind of profession. Or microbiology especially, you have to discipline enough, but you should be dedicated to your job profile. You must have the analytical capability, you must have the research capability, you have the ability to ensure your tactics. You have to maintain some good laboratory practice, that is called GLP. You should be aware of quality assurance, quality controls. These are, I think, the key criteria for a microbiologist, and the safety rules. Safety rules are most important, because in the field of microbiology and especially in virology, we are dealing with the even very dangerous pathogens, which are very infectious and very pathogenic to the human beings. And the handler or user of this pathogen must be aware of that particular pathogen and must follow the biosafety precaution for his or her safety. So there are lots of biosafety precautions we are using. That is, there are some levels called biosafety levels. There are 1 to 4. There are some biosafety levels. So it is an increasing order. So biosafety 1 is in which we deal with normally non-pathogenic bacteria or microbes, just like E. coli. And for biosafety 2 levels, you remember the COVID pandemic, because the SARS-CoV-2 viruses, like that, this kind of virus can be dealt with the biosafety level 2, which is advanced level of biosafety. After that, biosafety 3 is more advanced than the biosafety level 2, and even biosafety level 4 is the most advanced one, where you can you have to wear some positive pressure suit. You cannot exit without disinfecting all of your gowns and all the goods you have handled in the laboratory. So lots of precautions have to be taken care of. So these are the biosafety levels. Those students or research scholars or freshers should be aware of these rules, and you should be dedicated for your job. That is the key criteria or key skill you may consider to work with. So laboratory experience in the biological science sector is very important. because without experiencing the laboratory procedure, you can't gain any knowledge. The theoretical knowledge, I must say that based on the theory, you can gain the knowledge. Based on the theorem, all the theorem and principle, all lab principles and procedures have been designed. But without undergoing the practical experience, without the exposure of the reality of the lab, how it works, how all the pathogens are treated, how the diagnostic test has been carried out, so you will not be so successful microbiologist or virologist. For the students I am talking about, so students who are already pursuing or who are going to pursue these courses in their career. So generally in India and internationally wise, the curriculum has been designed in such a way that there is a practical session in these professional courses. So after completing theory, there are some practical session in the reputed laboratory. Some institutions have their own sophisticated laboratory, and other institution maybe you're tying up with the national level laboratory. So for example, at Dibrugarh University, at the time of our study, the Dibrugarh University Department of Biotechnology have collaborated with the ICMR lab, that is Regional Medical Research Center lab. So this collaboration work helps to build up your skills. So there you can, as I have told earlier, the skills of basic skills of the microbiologist or a virologist, which can be polished in there, which are taught in that laboratory, how to handle pipette, how to carry out your basic laboratory work, how to do the biomedical waste disposal, that is very important in virology division, BMW. So those all are covered in your practical lab sessions. So practical laboratory experience is very crucial, where you also will be taught the biosafety levels, the PPE kits, how to maintain the equipments, how to run the diagnostic test, what is quality control, what is quality assurance. This all are covered in a practical laboratory phase. So practical laboratory experience has a great value in this sector. After COVID-19 pandemic, the field of microbiology and virology has evolved a lot, because before COVID-19 pandemic, most of the labs were not so updated as compared to the present scenario. So after pandemic, all the labs, starting from national level to state and district level laboratories, has been well equipped with the support of government, whether state or national government support, well equipped with advanced sophisticated technology, just like RT-PCR machines, biosafety cabinets, and analyzer, I think, and then at state levels and national level also the next generation sequencing platform, auto analyzer, automated nucleic acid extractor platform, which are the latest advancement, I think, in the local or state level labs, so which are very good or promising for the in the field of microbiology and virology. And latest advancement, the COVID-19, we are not exactly ready at that time to handle such a pandemic situation, to combat with that situation. But somehow we managed collaboratively. We have worked with the microbiologists and medical peoples, and also with the support of government. We have successfully defeated the virus. But one positive thing is that all the people, all the grassroots level technicians, starting from the technicians to the scientist level peoples, were get the exposure to this advanced technology, and how rapidly we can perform a test, how rapidly we can report based on a molecular test. Because in general, before the pandemic, if we talk about any kind of molecular test, it hardly take around 1 to 2 days something, because we have to export some sample in another lab, which national level lab. It hardly takes 2 to 3 days during the transport. After processing and getting the result, it will take another few days. So but in case of COVID-19, when the molecular test starts in each and everywhere, that due to the pressure and also to combat that critical situation, the workers and the laboratory technicians and also all the peoples which are linked to that virology lab, worked very hard and reported timely. And also for infrastructural development, we can consider it, there is lots of advancement in the infrastructure also, and government fund has been released in this sector for to make ready for the next outbreak of any diseases or like that similar cases. So for district levels or state levels, such as the government bodies like NHM, or there are some bodies that IDSP and NBBDCP, those who have also offered a lot, worked hard to combat this pandemic situation. Now, recently there is a news of monkeypox virus, that is also, this facility is also available at Gauhati Medical College and some sophisticated labs, reputed labs in the northeast area. So, but that is also a RT-PCR, PCR based diagnostic test. So these are the challenges I think we are facing, and we will getting the positive results also. That's all. So if we want to talk about the monkeypox virus, which is basically a clade2 virus, that is called MPXV clade. This is a zoonotic disease. The zoonotic disease is what which has an intermediate animal host directly. It was first, I think, identified among African breed of monkeys in 1958, and the first case diagnosed in human is I think 1970 in Southern Africa. So the virus, one peculiar thing of virus is that it get evolved in every cycles. The genetic structure or genetic material is designed in such a way that any kind of viral genome get evolved and get mutated. So basically, in a simple word, the genetic material, the sequence of the genetic material get changed in every cycles of their life, from one generation after one generation to another. So that is a very challenging task. That's why for to invent or to design a vaccine, it's very challenging in case of viruses. But in case of monkey virus, it is a DNA virus. It is not so problematic to develop the vaccine. But monkeypox viruses, now the cases are very limited as per the government record. I think the first 1 or 2 cases in Kerala, I think India, a few months back. But the labs are ready to diagnose, to provide the diagnostic test for monkeypox viruses, and people should not be panic of that, because should be fully aware of that. If the sign and symptoms occurs in some people or in the society or in somewhere, people must consult the healthcare provider or the authority. People should go to the clinics and hospital to specialists to consult about sign and symptoms. So people should consult the doctors directly. And the basic signs and symptoms are the painful sores in any area of body, that can be very painful. So for diagnosis of monkeypox virus, we have to take swabs, like in case of COVID-19, we collected swabs or oropharyngeals, and the nasal swabs were collected to diagnose the COVID SARS-CoV-2 virus. But in case of monkeypox virus, you have to collect swabs from the wounds and sores of any body parts. After that, this has to be extracted, DNA has to be extracted, and we have to perform the PCR test for to check whether the DNA of monkeypox virus is present or not. So people should be aware. Always, our duty has to be keep alert, keep the people. So emerging trends for the aspiring microbiologist in the field of microbiology as well as in the field of virology. If we consider the field of microbiology, that is, I must say the AMR, that is called the antimicrobial resistance pattern. That is the most challenging scenario nowadays, because every pathogen has evolved and they have developed the antimicrobial potential. Because see, if infection happens, doctors or physicians used to treat the infection with a particular antibiotic. But the repeated use of the same antibiotics, the microbes get resistance against that particular antibiotics. So antibiotics sometimes they don't work on that particular microbes, and the condition get worse and worse. We have to apply the new antibiotics. So that's why AMR or antimicrobial susceptibility is very important. That's why for any kind of infection, whether it is the urine infection or other infection, doctor always prescribe or advised for a routine examination test as well as the culture and sensitivity test. In culture and sensitivity, we can get the idea or definite idea about what antibiotic will work on that particular microbes and what has the sensitivity, what kind of antibiotics has the sensitivity towards the microbes, and which antibiotics are resistant. That particular microbes develops resistance against what kind of antibiotics. So that is the AMR. AMR program has been conducted nationally and internationally by various government bodies. So that is the most promising, I think, program under the field of microbiology. And again, secondly, I must say the genetics and molecular biology. In the field of genetics and molecular biology, tremendous advancement has been developing day after day. So people and students and especially the aspirants should be aware of that advancement. They can work in that field also, because in present days, all the if you consider the vaccine, if we consider the antibiotics or any drugs, that is all based on the genetic makeup of a pathogen. So based on that genetic makeup, some drug molecular modeling is done. After that, the clinical trial is passed, and then one drug is get ready and it is released in the market. So that is the genetics and molecular biology is very important for drug discovery as well as the diagnostic test, so on. And research and development, thirdly, research and development sector, that is a very important or promising sector for aspirant microbiologists. So, and fourthly, I can conclude that the vaccine technology is a most promising field. So one can also learn and also try to get into this vaccine industries, for the future career growth. Career prospects, that is a vast career prospects. It is a very big career opportunity after doing microbiology or virology. As a if somebody chooses the virology or microbiology, or any advanced biological science as their part of career, they can work into the for microbiology. For the microbiologist, the pharma industry and the food industry, food and beverages industry, there are lots of opening for quality control job, quality assurance job, because in every food industry and dairy industries and drug industries, manufacturers, so in each lot and each batch of the product, you have to ensure about their quality, you have to ensure the standards. For that reason, they require a skilled microbiologist or biotechnologist or a pharma people. So for in professional life, one can choose as a microbiologist, they can join this industries. And also for virologists, diagnostic sector is the I think research and diagnostics sector is the best sector to work with. And also the virologist and microbiologist has the opportunity to work under the manufacturing giants, the companies like Abbott, Biocons and pharma industries, which are nowadays Roche Diagnostics, which are nowadays manufacturing the automated platform for to run the molecular biology test, to run the nucleic acid extraction test, to do the sequencing. So those giant companies frequently hires this professionals to work under them as a application scientist or as a analytical scientist. So there are lots of opportunities for a virologist or microbiologist. And if we consider the government job or government sector, so microbiologist has the opportunity to join the government sector, especially in the public health sectors like IDSP. There are some programs under government. It's called, for example, IDSP. And NVBDCP, National Vector-Borne Disease Control Program. So in this program, the microbiologist has the great responsibility to be a part of the rapid response teams, to ensure to set up a new microbiology laboratory in the district level, to create some awareness program among the community, to create awareness against the new emerging diseases or any kind of new emergence of pathogens, and to ensure the quality of the lab standards, quality of reporting, timely reporting. So communication with the doctors to the starting from the public to the healthcare provider and to the upper level, so to the government directly. So these are the key roles which are played by the microbiologists in government sector. So lots of opportunities are there. I must say that there is a ocean of opportunity for the microbiologist and the virologist. In my career, I started in the field of virology, I think in 2011 when I was in Assam Medical College. So I started works with under the guideship of Dr. A.K. Borthakur, the HOD of microbiology at that time. So my first project was on AES, acute encephalitis syndrome. I worked on Japanese encephalitis, the West Nile virus, herpes simplex virus, like that. That was a 5 years project. After that, I joined as a technical officer in the Department of Microbiology under Regional STI Center, that is run under the National AIDS Control Program or National AIDS Control Organization, NACO. So we are dealing with all the pathogens which are responsible for the STI syndromes, so sexually transmitted infections. Now presently I am working on the STI molecular diagnostic test as well as the HIV. HIV, HIV is a very nowadays very common among the younger population of entire nation, and globally it is a very emerging pathogens, viral pathogens. So in HIV, we are right now we are doing the HIV viral load testing, because viral load is just like in case of at the time of COVID, we never reported the viral load, but viral load means it indicates the how much the infection level in the body of a particular virus. At that time, I remember you must be aware of that there is a term called CT value at the time of COVID. So CT value also indicates uh, not directly, but it gives some idea about the viral load. If the CT value is higher, then the viral infection or viral titer is low, and when the CT value is very low, then the viral titer is quite high in your body. So like that, but to be very precise, it should be in terms of viral load. So HIV, we are doing viral load testing, and also we have been doing the viral load for a hepatitis B infection and hepatitis C infection, and I also I am involved in the molecular testing of HPV, HPV virus, which is responsible for carcinoma, genital carcinoma, the cancer, and so HPV is the sector I am dealing with, and also some other bacteria like scrap typhus. I have designed it. So many in-house PCR techniques, molecular techniques, which for the diagnosis of those pathogens. Like in case I have developed in-house techniques for Neisseria gonorrhea, chlamydia trachomatis, mycoplasma hominis, scrap typhus. These are the pathogens we are dealing with. We have been running the in-house molecular test at Gauhati Medical College, and I guided so many postgraduate theses of medical students also, and we have been working in collaboration with some universities of Northeast, like Kaziranga universities and other Gauhati universities, like that. So these are the sectors I am presently working in this field. So for the students who want to build their career in the field of microbiology, and especially in virology, or the aspirants of northeastern states, so I must conclude that the one must be very sincere and should be with a enthusiastic mind to get updated with the latest advancement in the field of in both the field microbiology as well as virology. So you should be aware of those advancements. You should search in the internet the latest advancement, what is the latest research outcome national wise or international wise. So you can go for multiple platforms are available in the internet. There is a platform called PubMed, PUBMAD. So you can search any any title there. As for example, you can type for HIV in PubMed portal, then you will get all the information related to HIV, which all the published journals. You can put the in details also for example, if you want to know that what is the update of vaccine development in case of HIV, because see some are the challenges there. I think I consider the most challenges in the field of virology is that scientists has not been able to discover certain vaccine against certain pathogens, viral pathogens, just like HIV and hepatitis C virus, like that, because they are the RNA virus. The RNA virus, due to the reverse transcriptase activity and for the integrase activity of the HIV virus with the human genome, this is quite difficult to develop the vaccine, because the I have already mentioned earlier, the nucleic acid sequences or genetic makeups get evolved, get changed, get mutated in every cycle. So that was the main challenge. So if somebody want to know about the latest update for the vaccine technology or vaccine development against those viruses, you can type the vaccine development in HIV or HIV virus. Then you can find the list of the journals or latest published report, global reports, global wise. So you can go through those articles and get the idea, and this way you can get updated with the latest invention and technologies, and what is the research researches going on and global platform. So that is one advice, and please work hard and do the competitive entrance test. Those students who wants to build their career in this field, you prepare yourself and go for it. I think, because I remember that Walt Disney once said that if you dream it, you can have it. So please keep dreaming, and please work hard to build your career in any discipline or any platform. To get the success, you must have to work hard. So I thank you. Best wishes to all of you from my side, and I'll be available for any consultation, or I'll be there. You can consult me at any time regarding the career growth or any kind of research discussion if you want to do with me. So I'll be ready. I'll be available. I feel very grateful to be a part of this huge program organized under the net fee. And the Advancing Northeast is, I must say, it is a very good platform and very good initiative undertaken for the to create awareness among the northeastern students and population in the field of science, technology, tourism, healthcare, and any other professions. So this is a great initiative. I am very thankful to be a part of this, and my best wishes with you. This is Ayurchandra Molecular Biology Laboratory, designed by me. This is the actual laboratory. So workflow starts like this for the PCR room. This is the master mix preparation room. Okay. Let's have a look inside with the 4-degree domestic refrigerator and the laminar airflow cabinet. Fully air conditioned section. It should be fully closed. Next is template edition room. Here we generally add template RNA or DNA, which is equipped with another laminar airflow dedicated for template edition, along with the PCR plate centrifuge, mini centrifuge or spin, along with the -20 refrigerator, deep freezer, that is, for the storage of kits and reagents, along with the ice pads and cool pads, etc. All are maintained. Temperature records are maintained daily basis with it AC, air conditioned room. And the third and final one is PCR room, where we do the real-time as well as RT-PCR test, equipped with the measure and the king instrument. This is called Light Cycler 96 from Ross Diagnostics. This is the real-time PCR platform, equipped with the desktop PC with printer for report generation. And we have the BMW pins. This is the recording table. and it is also equipped with air condition. The temperature has to be maintained in all section. So this is the workflow. Now let's move to the primary section, that is from sample receiving and processing. Here is the sample receiving, sample storage, -20 freezer. This is the another lab for sample processing. This is the donning area. Entering with the donning area, we can move to the sample processing room. This is the BSL2 SFT level 2 cabinet where all the sample processing and extractions are being done. AC is there here also. Other reagents and consumables over there. Now the extraction room, we have a fully facilitated automated nucleic acid extractor. This is the model is Nextron 96. So we can extract 96 sample at a time within a period of max 40 minutes. This is mandatory here also. And these are the bins for biohazard waste disposal. Also we have a washroom, and these are duffing area. So thank you for watching this video. Thank you.